we'll see in detail about myxoma. Other tumors we will see in brief. So, benign tumors, the first prototype of benign cardiac tumor is a myxoma, also called as atrial myxoma or more commonly as left atrial myxoma. As we can see here, it is a greenish yellow gelatinous tumor which is a pedunculated tumor with a stalk with focus of hemorrhage. They are friable and very vascular. So, this is a histopathology showing spindle cells with the myxoid background. The cell of origin is a multipotent mesenchymal cell, MN. So, the commonest cardiac tumor of all the tumors, 25% are atrial myxomas. The usual location is the left atrium in 2/3 of cases. The other locations, atypical locations are right atrium, left ventricle, right ventricle. In almost 5%, more than one site, familial pattern is seen in 5 to 10% where they can present very early in second decade or have multiple sites of insertion or recurrences, very common recurrences. Recurrences are seen up to 5 to 8% of patients where we have to suspect syndromic myxoma like Carney's complex, Lamb or Name syndrome. Other features, very commonly expanded cytokine is the interleukin 6 which is responsible for the constitutional symptoms of myxoma. The other factor is the vascular endothelial growth factor which is responsible for the initial tumor growth and angiogenesis. That is why it is very vascular and friable. Tumor embolization is a common presenting symptom in more than 1/3 of cases. Among them 85% have CNS embolization presenting as either stroke or TIA, or they can have multiple regressing berry-aneurysms, the regression not spontaneously but after resection of the myxoma. Other embolic sites can be retinal, peripheral arterial, pulmonary arterial from the RA site, RA myxoma or paradoxical embolism, coronary artery also in case of LA myxoma. The mean size is about 5 centimeters and the weight is about 180 grams. Calcified tumors like a prosthetic valve, they can also cause hemolytic anemias. So, these are examples of familial myxoma. They have a combination of myxomas presenting early, multiple atypical sites and recurrence frequently. They can be associated with lentigens or ephyllites. As you can see, lentigens are hyperpigmented patches over the face, and myxoma of not only the atria but also of the skin. You can see like a stalk and peduncle, same pattern like it presents in the atrium. And in addition to skin myxomas, it can present as primary pigmented nodular adrenocortical disease. So, these are examples of familiar myxomas presenting along with skin and adrenal cortical presentation. These are few examples of the myxoma. Here you can see it is an atypical site of involvement, right atrium prolapsing into through the tricuspid valve into the right ventricle. So, it can present as TS or TR or sudden RVOT obstruction resulting in sudden cardiac death. So, atypical location means we have to screen the relatives also for presence of myxoma. This is a classical left atrial myxoma attached to the interatrial septum and prolapsing through the mitral valve into the left ventricle. You can see the myxoma here, left atrial myxoma. So, echo alone is good enough to diagnose a myxoma. There is no incremental value of adding a CT or MRI except if you are suspecting multiple atypical sites like LV, RV or RA involvement.